One of the biggest misconceptions I see is that people think that their body needs to be perfectly symmetrical to be healthy. They'll come into the office and say, my shoulders aren't level, one hip is higher than the other, my head tilts to one side, one leg looks shorter, and they assume that if we can just make everything perfectly straight, all their problems will disappear. But that's not really how the human body works. I personally don't look at asymmetries as something that automatically needs to be fixed. I look at them as information. Those patterns tell me something about how your nervous system is organizing movement and stability. They're clues, they're not necessarily the problem itself. Look at any professional athlete and I can pretty much guarantee that not one of them is perfectly symmetrical. Yet many of these people perform at incredibly high levels. And why? Because function matters more than perfect symmetry. My primary goal isn't to force your body into some idealized posture. My goal is to help your nervous system create better options. Can you rotate comfortably? Can you balance confidently? Can you bend, lift, walk, and move without pain? Can your body adapt to changing demands? Those questions are often much more important than whether your shoulders are perfectly level. Before I worry about correcting posture, I want to know whether the nervous system feels safe enough to move well in the first place. Because when the system is stuck in protection mode, forcing posture often doesn't create lasting change. Sometimes people become so focused on how their body looks that they stop paying attention to how it's functioning. In my office, I'm usually more interested in adaptability than symmetry. Can your nervous system respond appropriately to stress? Can it stabilize when needed? Can it relax when needed? Can it shift efficiently between movement patterns? Those qualities often have a much bigger impact on pain, performance, balance, and overall health. So when I assess posture, balance, eye movement, gait, or spinal motion, I'm not looking for perfection. I'm looking for patterns. I'm looking for areas where the nervous system may be working harder than it needs to. And then we use specific inputs, whether it's chiropractic adjustments, sensory stimulation, movement exercises, balance work, breathing, or rehabilitation to help improve the system's efficiency. At NeuroBalance, the goal isn't to create a perfectly symmetrical body. The goal is to help you move better, feel better, and adapt better. Because perfect posture isn't always possible. But a more adaptable, resilient nervous system is something we can definitely work toward. If you've been told that every ache and pain is because you're out of alignment, I'd encourage you to think just a little bit deeper. Sometimes the question isn't how symmetrical am I? The better question is how well am I functioning? And in my clinical experience, that's where real progress begins. I'm Dr. Joshua Kievitt with NeuroBalance Chiropractic in Olympia, Washington.